and they may be something that Mother Nature brings onto the horse does to itself, and or we as farriers end up creating as you go after white line disease or something like that. They may be acute. They may occur days after an initial injury, just due to the lack of stability that causes the veterinarian and the farrier to make the decision that that piece of foot needs to be removed just to allow the healability of that foot. The avulsions, whether they be acute or chronic, the farrier's role, I think, number one, is to seek veterinary assistance. Not all farriers feel that way, but I think the law feels that way, and I think you're just it's a housekeeping, cover your back type situation. I think that most good horseshoers are connected with a good equine doctor, as vice versa. And so to seek that veterinary assistance and say we've got an avulsion, that we've got sensitive structures exposed, going to need some help here, I think that's one of the first things that you need to do. Certainly need to understand the anatomy of the foot. There's a lot of guys who shoe horses, not necessarily full-time for a living, that they dabble in it a little bit. If they would run into a situation where you have a severe an avulsion and they don't understand all of the anatomy or the function and the mechanics of the foot, it's probably best to raise your hand and say, I don't understand all this and need help. And I think that farrier asking for that help or acknowledging his limited exposure to that will just earn him respect in everybody's eyes, the vet's eyes, the owner's eyes, whoever the farrier is that he seeks to get help from. They're just going to give him some respect because he's open and honest about his limited ability. I think the farrier is going to have to be able to think outside the box. You're not dealing with the norm anymore, so you have to be able to get away from the textbook and proceed as to what is best for the horse. I think you need to have farrier skills to be able to address the problem. We'll get into that here. And I think most importantly, you need to be optimistic with your client, yet be honest with them about what they may be looking at. When I talk about the veterinarian assistance, I think that depending on the severity of the avulsion, certainly x-rays to determine structural damage are a must. If you have a fracture in a wing of a coffin bone, or you have joint infection or intrusion, you need that veterinarian's assistance. Certainly, I don't have x-ray vision, and I can't tell all that stuff by some of the messes that you run into. So x-rays are a good place to start, gives you a baseline to work from. Certainly nerve blocks, they'll be required for the initial treatment. Depending on the severity of the avulsion, if the horse has got a traumatic injury there, they're going to be pretty touchy about that foot, you doing anything with that foot. So the nerve blocks being put in by the veterinarian are just going to take away that sensation so that the horse will allow you to do his job. A very good possibility that sedation is going to be required for restraint, regardless if the horse is a nice horse or not. He's obviously been through a traumatic situation, and he's probably not going to be trusting anybody in the immediate future. So again, you're working with sensitive structures, with a compromised foot. Sedation is just going to allow the horse to allow you to do your job properly. And so again, when I say your exposed structures are present, legally you're covered as a farrier when you have the supervision and the guidance of the veterinarian. Certainly I want to have somebody in there with your carving abilities. Same thing with the foot. We all can see a good solid well-balanced foot. But when you have a mess, you have to be able to create that foot again and understand how it reacts to weight bearing and all the mechanics that are involved with that, so that it doesn't flare, dish, get away from you as you're dealing with it. So a thorough understanding of the hoof capsule is necessary just to understand the damage that's present, what you're seeing, whether you're seeing corium or cartilage or bone. You need to understand that. So I emphasize here with anatomy. You can't know too much anatomy. When we start talking about thinking outside the box, with an avulsion, you've got a foot that's compromised, you have a different situation. Your daily routine of nailing a shoe on with 6 nails, very well probably not possible. So don't rule out the use of many options, whether it be wooden shoes or acrylics, casting materials, screws to apply the appliances, whatever else is necessary to treat the foot. I myself am kind of a traditionalist when it comes to farriery, and I take pride in that, but I've also learned that the more you get into therapeutic situations, you need to think outside that box and look for other options besides the steel horseshoe to get the job done. So when we talk about the farrier the skills here is to redistribute the load or unload the affected area of the foot. So the farrier should be able to fabricate and apply any type of appropriate shoe, whether that be, as an example here on the left-hand side, a handmade heart bar shoe. You can certainly buy a nice heart bar shoe that are on the market. They work well. On the right-hand side here is just a wooden shoe that's been applied with screws and has some dental impression material underneath the foot, has some struts at the back of the foot to give it some support. So a wide range of what you may want to use depending on the situation, but it's a good thing to be able to apply and create whatever it is you need to do. Communication. I think we all need to realize that horses are miraculous healers. You have some horses get hurt and you think, oh my gosh, they'll never get over this. And 6 months, a year from now, you can't even tell anything happened, whether it be a cut in the shoulder or the hip or, and a lot of times in the foot as well, that they are truly miraculous healers. So I think it's our responsibility as the farrier to let owners know the need for consistent and timely care is necessary for you to do your job. If we're shoeing horses on a daily basis, and we've all run into the customer that wants to stretch them into 8 weeks or 10 weeks or whatever, and you come back and you've got a flare here, a dish here, because they haven't allowed you the opportunity to keep that foot gathered up. And so the very same thing applies here, only you add that other complication, then that you have a compromised foot. So you really need to stress. And I have some pictures a little later in the PowerPoint presentation of a client of mine that, even though I stressed this, they wanted to stretch the time frame, and it complicates your job. It just does. I think we need to be upfront and honest with them about the added time and material costs that are to be expected. I think that how I do my business when I run into a therapeutic situation is because you're dealing with a veterinarian and you've got downtime waiting on x-rays to process and nerve blocks to set in and all that stuff. I don't have a flat, this is what I charge to shoe a horse, apply here. I figure what it costs me to shoe a horse in an hour, and that is my hourly rate that then once the clock starts, that's what my hourly rate is. So I'm still making money while I'm standing around doing nothing, just being there ready to go to work, and then certainly add on to my materials for that added expense. Explaining the necessity for the horse owner to monitor the progress of the healing, whether they're treating that foot You know, maybe you've got a hospital plate on that they need to be treating. They need to be monitoring that, and you need to inform them not just of what they might be seeing, but what they might be smelling. If the foot's not going well and it's getting infection or something like that, they're going to have a bad aroma. Certainly, proud flesh can become a problem, and so you might want to, again, just familiarize them that granulation tissue is good, but when it goes into monster form, that's your proud flesh, and that causes a problem. So the treatment that I've used, and I just have a couple of case studies here that I want to share with you folks. This was a horse, an aged gelding horse, a nice horse, lives in a stall, laid down in the stall, and got his foot underneath the door. When he went to stand up from laying down, he got his foot caught underneath the door and split his foot. After a week's worth of the owner just trying to take care of this, they got nervous. They'd been wrapping it and vet wrapping it and putting the Liability on it, but every time the horse moved, and he was like a grade 4, almost 5 lame, it's a hind foot, he wasn't making progress. So the owners got nervous, went to the vet clinic. They've made arrangements for the vet that I work with, made arrangements for me to be there. And so the blood that you see on the floor here underneath that foot is this horse just walking into the vet clinic. So it was the trauma just of the trailer ride a week later that causes this hemorrhage that you're seeing on the floor. So in that determination there as the vet, and we look at this, and that whole heel, everything is loose on that. There's no way you're going to stabilize that because it's a week old and it's in trouble. So after the veterinarian, the owner, and myself all come to a conclusion that we needed to remove that part of the foot, we administered nerve blocks, sedation again, so that we could work on this foot, and the horse allow us to do it. And you can see here that we just pretty much had to get a hold of it, and it come right off. Certainly exposing some corium there. X-rays showed that we did not have any damage to the wing of the coffin bone there, so we progressed. Now, what I did to start with was put a heart bar shoe on, and I applied this, placing the shoe to create ground surface under the area of the hoof wall loss. I'm a big believer that you need to put the shoe where the foot would be, could be, and should be if it was a healthy foot. If you look at the center picture on that screen there, you can see from the bottom of the foot, the solar aspect there, you've got a pretty substantial amount of foot that's missing. You also have wet material or corium that's exposed on the bottom of the foot here. So this was my option to use at the time. Did not use any EquiBuild or SoulGuard or EquiPack, anything like that, just because it's still wet. And had I covered that and that been wet, that very well could have blown up on me, abscessed, created a bigger problem. So we treated this with just like a diaper and gentle iodine, 1%, to treat this and pack this, and sent the horse home. And in the next picture over, you can see, as the horse coming back, a tremendous amount of healing going on in that 6-week setting. On my second reset of this horse, when we took x-rays of this horse, we actually had a little bit of lateral rotation, and I don't know what you could have done better because of the exposed corium on the bottom of the foot. When I did reset this horse and kept him in that heart bar shoe, and the bottom of my foot had dried up well, then I filled the bottom of that foot with EquiBuild, the fast set EquiBuild, so that I had good support on the bottom of the foot all the way across. And then I didn't have that lever arm of the shoe creating problems for me. Now, the second picture is a final picture of this horse that you can see that we've got tremendous healing here. Is that good tubular horn or intertubular horn? I don't know, and I can't tell you. I don't know of anybody that can unless you put that underneath a microscope and tell what kind of horn that is. It's certainly compromised some, but it's together. The horse is sound. We keep him shod just because he's missing a part of the foot there. And if you look clear to the right there, you can see that I still continue to put that shoe where that foot would be, could be, and should be if it was healthy. My second case study that I want to share with you is about a quarter horse. Came in from the pasture with a severe avulsion. Carrying its foot, would not touch ground, had nothing to do with it. Certainly, we needed a little bit of time. The vet was not available. I said, let's just hold on. We need x-rays here because there was a substantial amount, if I back up, a substantial amount of damage there. And I suspected that we had injury to P3. Very well could have been. And so I backed out of this situation saying, guys, we need to get a vet involved. We need to get some x-rays here before I can go forward. So again, we put the horse in a diaper and some gauze around this initially, just with some gentle iodine. They got it down to the vet clinic. When we were down to the vet clinic, they got the x-rays. We did not have issues going on in the bone. And so here's what you're seeing in about 7 days worth of time. And you can see that there's granulation tissue happening on the medial side of this foot, but a substantial amount of the foot is gone. Now, if you look at the picture on the right-hand side, the solar view of this foot, you can see I've got good sole here. I don't have sensitive structures like in the previous case. I don't have sole ripped away, exposing corium. That's a good thing. So my craftsmanship here tells me, okay, let's again put that shoe on where the foot would be, could be, should be. I again chose to use that heart bar shoe. And let me maybe elaborate just a little bit. I'm using that heart bar shoe as a support system to share the load. I'm not really putting any pressure with that tongue in the heart bar shoe. It's right against it. So the horse can settle on that a little bit if he chooses to, but he can get away from there. I don't have direct pressure applied. Certainly have mesh used that I'll use the EquiBuild again, the firmer material, just because it's more supportive. And I filled the bottom of that foot with that. In that bottom right-hand corner picture, you can see where that shoe comes out, where that foot would be if it was there. And yes, this is on the medial side of the horse, and you think he'll step on that, Jeff. If I left it like that, you're exactly right, he would have. But because you have that much sensitive stuff there, we're not leaving that exposed. Again, we're using some gauze around there, put a diaper back on him, and then we put him into like a blue Davis boot to give him that protection again, so there's no way he could step that shoe off. The nails were only nailed on the lateral side of the foot, but the bonding aspect of the EquiBuild helped hold on to that solar part, and this horse wore that shoe just perfect, no issues at all. The owner's role here is they were taking that off every other day and checking it for smell, for anything going on, any red flags, paying attention to the horse's temperature. But the horse worked well with them. The foot progressed along nicely. And so we stayed with that program, and that's what we did as we reset the horse. Eventually, I went back to just an open shoe, and you can see on the medial side there, I creased that shoe all the way back, just a keg shoe, but I creased it all the way back and punched a couple of nail holes back there. So I was finally able to get a nail hole on the caudal part of that inside heel. But as the foot grew down, and you can see I've worked very hard to keep my horn tubule straight. The picture on the left-hand side where you can see I'm getting after the front of the foot. Up there 3/4 of an inch, you can see the discoloration where I've gone clear through that hoof wall. But it's important to me to keep the integrity of the tubulars there. And if they are bent as they grow down, they have no choice other than to follow the path of laid before them. So I know textbook says you never get rid of more than half the width of the thickness of your hoof wall at any one setting. And that's fine, but that's not my world. When I have a horse like this, I'm going to go where I need to go, and I think that straight horn tubules is the most important. So again, I filled the foot on the right with Equibuild, and that's how that horse goes. He just shot in an open shoe today and is doing well. You can see certainly, again, is it intertubular horn or intratubular horn, or is it even horn growing on the dorsal wall there? But the horse is sound. That's the main thing, and the owner's a happy person. One other case study here that I wanted to share with you was it's certainly in an avulsion. It's a thoroughbred, came in acutely lame. Obviously, there's a laceration at the coronet band. To me, that white papilla at the top of the coronet band tell me I'm probably not going to have foot growing back. So I'm in trouble here a little bit. Now, when I consulted with my veterinarian and we met at the horse and looked at the horse here, we had actually discussed, because the avulsion part that you see here was actually pushed up and out, and by the white at the top of that avulsion there, thinking that is your coronet band that's going to produce your horn tubule, if we could save that, it'd be a great thing to do. We have very limited time. I mean, this happened in the night, and it's like 10 o'clock in the morning. We actually discussed about taking the bottom part of the foot off and trying to sew that back together in hopes of saving that coronet band, but better judgment got a hold of us and said no, because there was just so much pressure, and so again, the horse was sedated, nerve blocks were issued. We were pretty confident. We did not x-ray this horse just because of the laceration at the top. Didn't think we had damage down below, but we went ahead and removed that avulsion, thinking that it's just like a hangnail on Uri's finger. If it stays with you, then you need to get rid of it. Otherwise, every time you bang it, you're going to have problems. So you can see the picture. I got these pictures reversed here. I apologize for that. The one on the right, we've debrided that. We've washed the gunk and the evil spirits away just with a garden hose, and then we packed that with some gentle iodine and some gauze strips. And then we just put him in a diaper for a little bit to see where we were going to be at, and we give him about a week to 10 days. And when we come back to look at the horse, and we were going to put a shoe on him because he's pretty darn lame, this is what I got to see, and I was pleasantly surprised with the good reattachment there at the coronet band. I think I'm going to have hoof growth. Certainly in the middle there, you see the exposed corium that's inflamed and is bulging out a little bit. But I think we can progress here and get this horse shod. So again, being a fan of the heart bar shoe for this kind of situation, I put him in the heart bar shoe, used Equibuild again to give him solar support. And I just wish to point out there that the solid hoof wall growth at the coronet band, that the horse is coming right along. This is about 6 weeks of a setting here. The horse becomes sound, which was amazing. Now, if you can see, it's still wet around that corium, so I've not filled that in, because if you fill that in and it's still wet, it may ooze, it'll blow up and abscess on you and create a bigger problem. The second setting, so I'm 12 weeks into this here, the exposed tissue, that corium that was hanging out there, had cornified pretty well, and it was good, dry, hard, and so at that time I felt that I was able to fill that acrylic, or fill that in with an acrylic. I kept him in the heart bar shoe, but I filled that in and told him, if you want to turn the horse out for a bit, I'm good with that. He was going stir crazy in the stall, and I was worried about, as long as that corium was exposed, if another horse would step on him or he'd bang it up against the fence post, we'd have bigger problems. But once I was able to protect that with that acrylic on the outside, then I felt good for the horse to go out. This horse done so well that they let it go. Holy smoly. So here I emphasized earlier in the presentation that you need to stay on top of this stuff. You can see that they let it go, the acrylic fell out, the shoe fell off, and then they call and say, Jeff, hey, I think it's time for you to work on Pepper. And so now I just have a really compromised foot again. I have good even growth range at the cornet band, and I'm happy about that, but it's caused me trouble. The foot's getting away from me a little bit here. So this is where the horse was at the last time I worked on him. I've taken him out of the heart bar shoe because he's a thoroughbred. He's a little bit flat-footed. I just have him in a flat pad and an open shoe, and I was able to get a couple of nails with the heel here, and there's one clear at the toe on that side of the foot. I think that corium that you see is about grown out and down. It's good and hard. I don't think it's going to hurt. I did not fill this the last time. I don't think we're going to have a crack situation here. You see the crack going up there like a quarter crack would, but I think that's from the initial injury. And as I've kind of dusted the periopal ring there with my rasp, and that crack just doesn't go anywhere. So I think if the people will let me stay on top of it, we'll win this situation again. When I want to talk real quickly about the support shoes, certainly on the internet, I see a lot of guys using Z-bar shoes, and I understand the Z-bar, the flotation that it offers, but I want to explain why I don't use that Z-bar, but I'd rather use the heart bar shoe. The Z-bar offers flotation, but only when that horse is standing on solid, dry surface. So if the horse is bedded in sawdust or turned out on any kind of a deformable footing, whether it's sand in the indoor arena or sawdust, a soft paddock, whatever, now you have direct pressure that's placed on the compromised area of the foot that we are trying to protect. And if you have the heart bar on there, you give them that protection and that flotation regardless of what footing they are on. You can turn them out, and they don't have that direct pressure. So the Z-bar would work, but I don't have any horses that stand on cement 24/7 because I think they would be lamer from that than whatever injuries they were encountering. So I personally don't use a Z-bar shoe. I understand the thinking behind it, but I stay away from that, and I give them the full support and protection. Here, the heart bar giving you that protection, it gives you the ability to transfer some weight to a different area of the foot, but it protects the compromised area. So then to go one step farther, and this just, the farther I go in my career, you look back at the things you did and you say, I wouldn't do that today. And so consider the laminated horse where the sole's convex rather than concave, and P3 is wanting to come through. It's knocking on the door saying, I'm coming through. In my earlier days, because I've seen it on the internet and guys using this, the W shoe, I thought, well, all right, that makes sense. Then I don't have sole pressure at the if I'd used a full heart bar, I would have sole pressure, and I use the W shoe. But now as I sit back and I look at that, look at my exposed, compromised area of the foot that horse is going to break over his toe, and I offer him zero protection. I would never use this shoe again today. I would not. I would go into a wooden shoe or something like that where I could concave it out so that there is a place for that P3 that is convex that would be there, but I would offer it protection. So in conclusion of my presentation here, and I hope I haven't caused anybody stress, I hope to make you think just a little bit about protecting the foot and supporting it. And remember that I think you should put the shoe where the foot would be, could be, and should be if it was healthy. Stay with the program, be honest with your clients, and man, these horses are miraculous healers, and they'll make you look like a hero in the end. So I wish to say thanks to the American Farrier Journal for providing this venue, and to all of you for allowing me the opportunity to share.
Awesome. Thanks a lot, Jeff. So we'll go through a few questions. If you have any that you'd like to type in right now, we can handle those certainly right here. First thing, Jeff, a few people had the audio cut out for a bit. Just to elaborate and kind of explain, it kind of cut out at the part where you're talking about wooden Indian. What did you mean by that?
When I talk about the wooden Indian, if we all have old Blue out in the pasture that's got a great foot, I mean, he's got the kind of foot you could put the shoe on him sideways and he'd get along. That is your wooden Indian, a good ideal foot. If you take a tree stump that's ugly, and then you need to find a wooden Indian within that, use your creative mind to create that pretty hoof out of that tree stump. And so that's what I want you to then maintain when you have a compromised foot, that half your hoof wall's gone. Okay, you still need to be able to visualize what it should look like if you didn't have all that gunk and the crap and the bark and stuff in your way. Does that make sense?
Yes, yeah. All right, we got a few questions, various questions on the case studies. The first one is about Dylan, and that one was, what could or should those owners have done differently? And was there anything they could do to limit that hemorrhaging from the trailer ride?
Yeah, I think that foot was just in desperate need of attention. And maybe if they would have got that to the vet clinic at the actual onset of that, maybe they could have cast that foot and offered it stability by putting it in a cast. So maybe it would have reattached, but the more time that they allow to go by, that whole week in there, that movement, that foot's not healing and it's not going to heal. It's kind of like when we cut our hands with something. If you go get stitches now, we can get it back together. You leave it open for a while and you've created a nightmare.
Okay. Then going to the second case study, Buttercup, what caused that injury?
Have no idea. We never figured it out. The pasture is a clean pasture. They have no clue, and we have no idea what did that.
Yeah. And so trauma is always the cause of these problems?
Well, I shouldn't say always, but the majority of the time. An example of an avulsion, I mean, I've had white line disease cases where I remove that much of the foot, trying to expose it to oxygen. It's not an avulsion, but you're still dealing with the same compromised foot. Does that make sense?
Mm-hmm. So you talked about how you don't leave the area exposed. How often do you check the area? Is a week the general benchmark for that, or does it really depend on the case?
No, I think you want to be looking at that from the initial onset. You want to be looking at that every couple of days. Certainly your owner needs to be playing an active role there. They need to be getting in there, re-hitting it with the gentle iodine. You don't want to use strong iodine, that would burn it. They want to be smelling. Smell is so important with this. This is one of the reasons that I'm not a huge fan of the cast, is when they put that cast on there, then you can't see it, you can't get to it and look at it. And then you strictly rely upon your nose. And so I'm a little hesitant to use the cast. We have, but I'm darn sure glad that I have the veterinarian looking over my shoulder suggesting that's what we do when we do it.
Okay. And how do you determine your hourly rate when addressing this situation? Do you communicate the rate with the client prior to the work, and especially how do you address this, like with the novice or a new new client?
Yeah, as I explained a little bit earlier, I tried to, was that I figure my hourly rate to shoe a horse. If I can shoe a horse in an hour, which is about what it takes me, I know what I charge to shoe that horse. So certainly you're going to be standing at the vet clinic for a lengthy period of time while they take x-rays, while they're doing nerve blocks, you're waiting for them to set in, then they need to sedate the horse, and you're game planning all of this stuff. And so you need to start your clock when you get there. Some guys will start their clock when they leave home. I start my clock when I get there. That's what I would do if I was shoeing a horse. And that hourly rate that I have to shoe horses is what I charge for therapeutic work. I may only put on one shoe, but it may take me 2 hours to do so. In fairness to me and my business, I need to make the same amount of money working on a therapeutic situation as I do a good sound horse that stands easy and is, you can put the shoe on them sideways and get along. So that's how I figure my money plus your costs of your materials.
Okay. Now, are there any circumstances in which you would use a Z-bar or a W?
I won't today.
Okay.
I just don't today. I think that you need, the only example, let me say, back up. The only example that I could see using a Z-bar is I had the opportunity to work with Dr. Dryden, Vern Dryden from Rood and Riddle, and he used a Z-bar on a horse that had a severe corn in the corn of the foot, and he put a Z-bar on there, but then he put a hospital plate over the top of that, covering the entire solar portion of the foot, so he could take that hospital plate off, get to that infected corn, treat it, then put the hospital plate on. But he didn't have just a Z-bar on there without that solar protection of the hospital plate.
Okay. Now we have one last question. And what's the advantage of a heart bar with EquiBuild as opposed to just using EquiBuild alone?
Well, certainly I think you have a little bit more rigid support with that tongue in there than just the EquiBuild. If you could use an egg bar, and you could certainly probably get along just fine there. I'm looking for that added rigid support so that I know I have an area for them to get to if they need to, as that foot becomes a little convex as they bear weight. It pushes down, and they can come to that, have that stability, yet they can get away from that. That's why I don't add pressure. It's there for support.